I'm Dr. Robert Mitchell. I'm the Medical Director for Kraft Medical. I'm going to answer some of your questions regarding being on testosterone therapy. Testosterone replacement therapy is safe for our patients. We maintain that by testing a patient, looking at their testosterone levels, monitoring their estrogen levels, their PSA, which is a marker for prostate health, and hematocrit, which is a measure of red blood cell production. If controlling for those 4 variables, we're able to provide testosterone replacement therapy to a patient in a very safe manner. The possible side effects for testosterone therapy in males is the common side effects would be acne. There can also be issues related to breast tenderness, and those are addressed when those symptoms do arise, and we treat those when they do arise. The types of side effects that are of huge concern are issues related to blood clots. That's why we monitor hematocrit levels. And in a patient that has elevated hematocrit levels or elevated estrogen levels, there is treatment and things that can be done to avoid those symptoms. I think it's important for a patient starting testosterone replacement therapy to maybe have a question regarding blood pressure or their heart health. It's important to know and to remember that as, let's say, for example, a patient's age 20, they have a higher, more optimal testosterone level, and it doesn't negatively affect your blood pressure or your heart. And that's the same for testosterone replacement therapy. By having a program that is physician supervision, we're looking at lab data that might indicate an issue related to blood pressure, and that will be addressed specifically. But it's really important for patients to remember is that being on replacement therapy does not necessarily mean that this is dangerous for your heart or your blood pressure. A frequent concern of patients regarding testosterone replacement therapy and the possibility of developing prostate cancer. This is a fantastic question. It's been in the literature a lot. There's growing evidence to support male patients being on testosterone replacement therapy. And we're understanding that there is no relationship between being on testosterone replacement therapy and developing prostate cancer. I have made statements before that if a patient has been diagnosed with prostate cancer or undergoing treatment for prostate cancer, then we will delay the onset of testosterone replacement in that patient for a full 3 years of close, careful monitoring by their oncologist, and once they've determined to be cancer-free for 3 years, then it is determined to be safe to be on testosterone replacement therapy. Aggression and agitation will sometimes come up in conversations with patients, or sometimes more frequently from the spouse of a male patient that's considering starting treatment. My understanding and my experience has been that aggression or agitation can occur while patients on testosterone therapy, but surprisingly, it's not due to the testosterone. It's due to unmanaged levels of estrogen. So some programs offer testosterone therapy without monitoring of estrogen. We monitor and are extremely concerned about those estrogen levels as well. If those do become elevated, there is treatment for that, and we offer that to the patient. So to simply answer, testosterone treatment in and of itself does not cause aggression or agitation in male patients. Fertility in testosterone replacement therapy is a very important issue. There are some patients that are actively trying to have a child, and to be on testosterone injection it can be an issue for that patient. We advise patients that if they are actively trying to have a child, to use an alternative medication, which we offer, that improves their overall testosterone level but preserves their fertility. This effect of testosterone, if you are on treatment, this is a temporary effect. If you stop testosterone, your fertility status will return to its normal state. But for those that I know that are actively trying, we avoid testosterone specifically and use an alternative medication.